Hi everybody, welcome to my blog. So today I'm going to cover a subject which is very short, and again there's lots of reasons for that. One is because, as you know, I have a newborn baby who is 8 weeks old today, so time is of the essence at the moment, but I will get back into my swing, I promise. But also because it's a really common problem in babies, and I thought it would be really good to talk about it. And that problem is reflux. And so today I'm going to talk about what that is and when it's a problem, because it's not always a problem. So reflux is bringing up milk during or shortly after you've fed a baby. We can call it posseting, spitting up, or reflux, and it really depends to what extent the baby's doing that as to how serious or not it is. So the bringing up of these feeds is effortless. They're not heaving, they're not forcing it out, it just comes up. You'll suddenly see baby with milk spilling down their chin. They're not vomiting forcefully, in other words. They might have feeding difficulties, so when they're feeding they might be gagging, refusing to feed, or choking while they're feeding. They might have persistent hiccups, which is an irritation of the diaphragm. They might be coughing between feeds, not necessarily just when they're feeding, crying excessively, or even getting more ear infections than you would expect. So those are the signs of reflux and what it actually is. And certainly my little one has had reflux, and she must get hiccups 40 times a day. So that was her major issue initially, and then we moved on to vomiting, and then vomiting excessively, and then crying with it. And it kind of just developed as it got worse. So when should you worry? When did I worry? Well, you should certainly worry if they're not gaining weight appropriately, because that's obviously really serious in any baby, whatever's causing it. If it starts after 6 months, that's really rare, because usually it comes on quite soon in a newborn. If they're really spitting up their feeds frequently, so you're not convinced that they're actually keeping that much of it down. If they're refusing to feed, and that obviously would be the cause of them not gaining weight. If they're coughing and gagging when feeding, that's another sign to worry. Or if they really are excessively crying or irritable. And let's face it, all babies cry without a shadow of a doubt. But it's whether they're inconsolable and nothing will settle them. That's a worry. Because usually when a baby cries, it's for a reason. And if you satisfy that reason, whether it's hunger, a nappy change, or even just tired, they'll stop crying. So if it's excessive and you can't bring it to an end, then certainly that's something to worry about. Projectile vomiting, so vomiting that comes away from the face, that's very frequent, is a worry. If they have a tender or swollen tummy, if it's feeling hard and when you massage it, it hurts them. If they've got yellow-green vomit, that's a real worry and that's an emergency. If they're vomiting blood, that's an emergency. But if they're arching their back when they're feeding, pulling their legs up during or after feeds, that's usually a sign of reflux and that's causing them pain, and that's why they're doing that. So those are the signs to worry about. So what causes reflux? Well, the most common cause in a newborn is an immature esophageal sphincter. So that's the tight band that we all have at the bottom of our feeding tube that stops the contents of our stomach coming back up. In a baby, they don't really have that sphincter, so it's really common for food to come back up. And obviously with that comes acid from the tummy. So they can get what's called gastroesophageal reflux disease, where the acid is burning their windpipe, and that's what's causing the pain. It normally stops by a year when the sphincter actually kicks in and starts working in the way that yours and mine works. They can have a cow's milk allergy, and with that they quite often have a rash, vomiting, diarrhoea, but that too can be accompanied by reflux or with reflux. They might have a blockage in their intestine, and that's what's causing the reflux, the food to come back up, the acid to come up, and the projectile vomiting. That can also cause the green vomiting, and that's a medical emergency, so that really does need to be seen urgently, probably at A&E. So how does your GP diagnose a baby with reflux? Well, usually it's just on symptoms. So you go along, you take baby with you, you tell them the story, what's happening, no tests are needed, and the diagnosis is usually made. It's very rare to need other tests, and those other tests would be things like a camera going down, or a barium swallow where baby swallows barium and they have an x-ray to see how it's tracking through their intestine. Those are super rare. So usually it's symptoms alone and then we talk about treatment. So what is the treatment? No treatment at all is an option. Feeding advice, medication, surgery or alternative remedies. Those are the kind of areas we're looking at. So no treatment at all. If baby's gaining weight well, is otherwise well, is not really distressed by the reflux, then you can leave them alone and eventually the sphincter will start working and they will lose the reflux. Other things that you can try are feeding techniques. So having smaller feeds but more often so that their stomach isn't overfull. The most common reason for babies vomiting is too much food. Burping them often throughout the feed, even if that upsets them, as it does my little one because she just wants to feed, she's a guzzler. But stopping the feed, burping them, so lying them on your knees on their tummy and patting, sitting them really upright and keeping their back upright and patting their back, putting them over your shoulder, just moving them around until the wind comes up and their stomach isn't distended with it. Keeping them upright after a feed for about 30 minutes. So feeding them in as upright a position as you can, which is difficult sometimes with a bottle because obviously you need the milk to be in the teat. Breastfeeding you can do it, but it's still not easy. Keeping baby in the seated position while you're feeding. Just help the food to go down and stay down. And then keeping them in a seated position for about 30 minutes after the food has finished is also a good idea. You can use milk thickeners to actually help keep the milk in the stomach, but don't do this on your own. Do this with a GP's advice. So what if all of that isn't working? And quite often it doesn't work. And as a GP, I see parents with babies with reflux all of the time. So then we look at medication. So the medication really gets given in a ladder. So we start with something called Gaviscon, which is an alginate. It's a thickener. And it sits on top of the actual contents of the food in the stomach. It's a thick, chalky substance. Sorry, not a thickener. A thick, chalky substance that sits in the stomach on top of the food and holds it down to stop it coming back up. So that's the first thing we do. And you add that to bottles or you give it separately if you're breastfeeding. But that's always our first port of call. After that, if that's not working, we then look at things like H2 receptor antagonist, which is ranitidine. So it's like an antihistamine, but works in a slightly different way on the H2 receptors in the stomach and stops the stomach from producing too much acid. Or a PPI, a proton pump inhibitor, something like a metrazole, which does the same thing. Both of those stop the stomach from producing so much acid. So both of those are on the ladder next. If it were me, and it is me, because I have done this, I would go with ranitidine first because there are some longer term worries about PPIs. So I would always go with ranitidine, but it is personal choice and there are lots of babies on omeprazole and they're perfectly safe and it's working well. After that, if nothing's working and it's really bad, rarely, and I really do mean rarely, because usually those things do work and then baby grows out of it, surgery is needed. It's only needed in a very small number of cases, usually when the child has a serious underlying condition, so possibly things like cerebral palsy. And the surgery tightens the sphincter, so that then keeps the food and the acid in the stomach. Obviously, if baby has a blockage, and that's usually known as pyloric stenosis, then surgery is needed to unblock that. But those things happen very rarely, and in most cases baby will get better with just feeding techniques, Gaviscon, alginates, or the acid suppressors. So are there alternative remedies? Because I always look for you. There are. And I've had a good old search, and basically people are recommending just about everything from cumin seeds to castor oil to old cold tea, millions of things. I would say never use anything on a baby without medical advice because there haven't been any trials or tests, so you don't know if they're going to work. You don't know if they're going to do harm, and that's the most important thing. There's no evidence at all. So I wouldn't do any of those alternatives, as appealing as they might be. I would speak to your GP. Baby massage is reported as helping. Massage around the tummy in a clockwise direction to actually help the food go through the tummy, that kind of thing. Sleep the baby at an angle. So put something under the cot so the baby's sleeping like this, because then that just helps the food stay down rather than coming up, because when they're lying down it will come up much more easily. And I am sleeping my little one at an angle, and she does sleep quite well at night, so it seems to be working. So those are the treatments from doing nothing all the way through to medical and surgery. I think the most important thing is, if you really think it's a problem, see your GP and talk it through. And GPs are used to seeing this, so they'll be more than able to help you, guide you, and just listen. And sometimes as a mum, and I am guilty of this, I promise you, you can't be as rational about these things as you want to be, because it's your little one, they're crying, you're worrying, and you hit Google and then you get even more worried. Step away from Google, as I have, and see your GP. And I haven't treated my little one myself, I've seen my GP. And I think that's really important. Remember, it's usually harmless, and so treatment isn't necessarily needed. Simple measures usually help. If they are failing to thrive, losing weight, then it's important to see a doctor, and there is medication available. Surgery is rarely needed apart from in underlying cases or if there's a blockage. And always, always, always seek medical advice before you do anything that isn't those feeding techniques. I will be covering cow's milk protein allergy in the next few weeks, because that's another issue which sometimes complicates reflux and can actually look like reflux when actually it isn't. So it's important that we differentiate the two. So look out for that one, and do send me any questions that you have in advance of that one. And in the meantime, please do send me any topics that you want me to cover for you personally. I'm going to be doing psoriasis in the next few weeks. It's a big topic, so it needs a lot of planning, but someone has asked me for that and I'm happy to do it. And I'll be happy to do anything that you want me to do as well. Thanks for watching, it's really appreciated, and I'll see you next vlog.